Welcome. In this video, we'll be exploring multiple sclerosis, or MS, a complex and often misunderstood disease of the central nervous system. We'll delve into what causes it, how it affects the body, its symptoms, how it's diagnosed and treated, and what the future holds for those living with MS. Join us as we unravel the complexities of this challenging condition. Unfortunately, the exact cause of MS remains a mystery. However, scientists believe it's a combination of genetic predisposition and environmental factors. Individuals with certain genetic markers may be more susceptible, but these genes alone don't cause MS. Environmental triggers, such as viral infections like Epstein-Barr, low vitamin D levels, and smoking, are thought to play a role in initiating the autoimmune response that characterizes the disease. At its core, MS is an autoimmune disease where the body's immune system mistakenly attacks myelin. Myelin is the protective sheath that surrounds nerve fibers in the brain and spinal cord, much like insulation around an electrical wire. This attack causes inflammation and damage to the myelin, a process called demyelination. When myelin is damaged, nerve signals are disrupted or blocked entirely. This disruption leads to a wide range of neurological symptoms, depending on which areas of the central nervous system are affected. Over time, this process can also damage the underlying nerve fibers themselves, leading to more permanent disability. MS affects people worldwide, but its prevalence varies geographically. It's more common in regions further from the equator, suggesting a possible link to sunlight exposure and vitamin D production. Women are diagnosed with MS more often than men, and the typical age of onset is between 20 and 50 years old. While MS can occur in children and older adults, it's less common. Research is ongoing to understand these epidemiological patterns and identify potential risk factors. The signs and symptoms of MS are incredibly diverse and unpredictable, as they depend on the location and severity of demyelination. Common symptoms include fatigue, numbness or tingling in the limbs, muscle weakness, vision problems like blurred vision or double vision, balance and coordination difficulties, speech problems, dizziness, and cognitive dysfunction affecting memory, concentration, and processing speed. Some individuals may experience bowel and bladder problems, pain, and depression. It's important to remember that no two people experience MS in exactly the same way. Diagnosing MS can be a challenging process, as there's no single test that can definitively confirm the diagnosis. Doctors rely on a combination of factors including a detailed medical history, neurological examination, and various diagnostic tests. Magnetic resonance imaging, or MRI, is crucial for identifying lesions or areas of demyelination in the brain and spinal cord. Evoked potential studies measure the electrical activity of the brain in response to stimulation, helping to detect slowed nerve conduction. A spinal tap, or lumbar puncture, may be performed to analyze cerebrospinal fluid for specific markers associated with MS. These tests, along with the McDonald criteria, guide the diagnosis of MS, ensuring accurate identification of the disease. MS is typically classified into different forms based on the disease course. Relapsing remitting MS, or RS, is the most common form, characterized by periods of new or worsening symptoms called relapses, followed by periods of partial or complete recovery called remissions. Secondary progressive MS, or SPMS, often develops after RMS, with a gradual worsening of symptoms over time, with or without relapses. Primary progressive MS, or PS, is characterized by a slow and steady progression of symptoms from the outset, without distinct relapses or remissions. Clinically isolated syndrome, or CIS, refers to a single episode of neurological symptoms suggestive of MS, which may or may not develop into full-blown MS. While there's currently no cure for MS, various treatments are available to manage symptoms, slow disease progression, and improve quality of life. Disease-modifying therapies, or DMTs, are medications that aim to reduce the frequency and severity of relapses and slow the accumulation of disability. These include injectable medications, oral medications, and infusions. Symptomatic treatments, such as medications for fatigue, pain, spasticity, and bladder problems, help manage specific symptoms. Physical therapy, occupational therapy, and speech therapy can improve function and independence. Lifestyle modifications, such as regular exercise, a healthy diet, and stress management, can also play a crucial role in managing MS. Because the exact cause of MS is unknown, there's no guaranteed way to prevent it. However, several lifestyle factors may reduce the risk. Maintaining adequate vitamin D levels through sunlight exposure or supplementation is often recommended. Avoiding smoking is crucial, as it's a known risk factor. Managing stress and maintaining a healthy diet and weight may also be beneficial. Research is ongoing to identify other potential preventative measures. The prognosis of MS varies widely from person to person, depending on the type of MS, the severity of symptoms, and the response to treatment. While some individuals may experience minimal disability and maintain a good quality of life for many years, Others may experience more significant disability. Recent research has focused on developing more effective DMTs, personalized treatment approaches, and regenerative therapies aimed at repairing damaged myelin. Scientists are also exploring the role of the gut microbiome, biomarkers, and genetic factors in MS. These advances offer hope for improved outcomes and a better future for those living with MS. Thank you for joining us on this journey to understand multiple sclerosis.